Welcome to the Active Play Everyday podcast powered by Next Playground. I'm your host, Dr. Emily, pediatrician, mom of three, and childhood wellness advocate. This show is about one simple goal: helping your family find a realistic path to 60 minutes of active play every day. No guilt, no pressure, just finding what works in real life. The information shared here is for education and inspiration. It's not medical advice. Always consult your healthcare provider for guidance specific to your family. All right, let's get moving.
Today, we're joined by Dr. Sujay Kansagra, great friend of mine, and many of you know him as That Sleep Doc. So he's a pediatric neurologist and really a pediatric sleep expert. He even has a new invention, the Lullabee, which you should look up if you've got younger kids that are sort of the toddler age. But he's here to talk to us today about what does sleep have to do with active play? I mean, this is like the rival podcast, right? Sujay, like we've got like me, active play, be awake, even the bright screen here. And we have Dr. Kansagra sitting, a little bit dimmer light, my rival, all about sleep. But as we were talking, what we realized together and what a lot of pediatricians realize is that these things go hand in hand, sort of moderate to vigorous exercise during the day and sleep at night all come together to optimize wellness. So Sujay, without further ado, let's jump right in and tell us, why should we even care about sleep? Let's start there.
That's a great question. Why do we sleep exactly? And it's becoming an increasingly difficult question to answer because there's so much that happens while we sleep. And so I kind of joke with people. It's like asking, well, why do we wake? Why do we have to be awake? Well, you do a lot of things while you're awake, right? So similarly with sleep, so important when it comes to body restoration, brain restoration, memory consolidation, when it comes to our ability to handle our emotions and impulsivity, constant attention. So many things that sleep does for us, to the point that I say, if you're not sleeping well, it worsens just about every medical or psychiatric condition that you may be experiencing.
As pediatricians, we know that sleep is linked to development, and your brain is doing a lot of work actually in restoration when you're sleeping. Just how active play is also linked to development. And I know that, when one of my children with ADHD does not get good sleep, the wheels fall off is one of my favorite expressions. Things are worse, just like you said. I also read somewhere that, a lot of kids who are diagnosed with ADHD, it's actually that they're not sleeping well at night. And if you can fix that, 100%. Symptoms get way better. So tell us, what you know about sleep and what you know about exercise or active play. How are they related? How should we be thinking about this?
I think that we are like good friends here instead of rivals when it comes to what our kids should be doing, because really they kind of play on off of each other. Getting great exercise, vigorous play during the day can feed into higher quality sleep at night. I'm convinced that those that actually sleep well at night will then go on the next day to have the appropriate energy and enthusiasm and focus to then engage in active play during the day. And so I think they really kind of link very nicely.
Yeah.
And there are a lot of benefits certainly when it comes to the active play during the day. We know that it actually helps when it comes to sleep consolidation, sleep onset, depth of sleep. We do have good studies that show that sleep certainly improves with exercise during the day.
Yeah. And so thinking about sort of the quality of your sleep, right? And I know you know all about this. And in fact, run a sleep study lab where you're measuring sort of every single aspect of how someone's sleeping. And this is very complex science. And, thinking through that, if they've done studies to show that if you increase your level of activity, right, and the recommendation is for kids is 60 minutes a day of active play, as I say it, or 60 minutes a day of moderate to vigorous activity. And you may know that only 1 in 4 kids in this country get that. And so if you're getting that, what you described almost sounds like this vicious cycle, but it's actually not vicious. It's this wonderful cycle, right? You're active during the day, you're increasing that activity, and then your quality of sleep goes up. And then the next day, you can be even more active. And then again, good quality sleep, until you get a cough or cold and the wheels fall off. But yeah.
Yeah, it is the winter season here coming up. So yeah, no, absolutely. And the opposite is also true. We know that a sedentary lifestyle worsens sleep metrics. Nightly sleep metrics we think worsen, and when it comes to sleep continuity, when it comes to what we call WASO, or wake after sleep onset, the amount of minutes that you're spending awake in bed, all of those things, those sleep metrics can worsen if you're not leading an active lifestyle.
Yeah. And in the news right now, and I know you've heard about this, and I think you even might have made an Instagram reel that I saw that I loved, and about melatonin and, this
Hmm.
new sort of controversy and a new study that came out that suggests that maybe it's not as good for us and probably not as good for kids as some might think. Yet my understanding is there are studies to suggest that really getting that active play in every day is actually probably works better than low dose melatonin for children. And that helps with that sleep initiation better or as good as. And so sort of curious what you think about that. Could this be a
Yeah, it's
better
interesting. Yeah.
answer? Yeah.
Well, I'll tell you that my biggest kind of gripe with melatonin is that we're oftentimes using it as a cure all for all sleep issues, and the challenge with, especially with young children, is that in most cases, if it's a behavioral sleep problem, melatonin is not necessarily going to help. It requires a behavioral intervention, typically at nighttime, to help the child fall asleep, whether it's older infants, toddlers, etc. Melatonin has its place. There is evidence that supports when it comes to circadian rhythm misalignments. Melatonin can be useful. It can be helpful in the setting of children that have a history of autism, ADHD. But for the most part, for a child that otherwise doesn't have any of those comorbid kind of conditions, melatonin plays very little role. And so then it really becomes kind of lifestyle factors, sleep hygiene factors, and then behavioral interventions, which is great because all of those are free. And that becomes more of an emphasis. I don't know if we've ever done like a head to head of low dose melatonin versus exercise. You may know this, but I haven't seen any data in that regard. But it all goes back to say, are we using melatonin for the right reasons?
Yeah.
And it's just not one of those cure alls, unfortunately.
Yeah, absolutely. And, I think through, some of the busiest, most active days my kids have had. And I feel like on some of those days, they just sort of collapse into bed and it's the easiest bedtime ever. But then I also want to ask you, is there a sort of a point of diminishing returns, do you think? I mean, do you think you can get sort of so physically exhausted or so ramped up with exercise that maybe it's not good for your sleep or it's harder to fall asleep? Do you think there are certain factors parents should consider about this?
Yeah, there is data that shows that timing of exercise is important. My caveat here is that if you exercise, whether you're an adult, whether you're a child, and you find that you can still, regardless of the time, can fall asleep easy, wake up fine the next day, have good energy, good quality sleep, then you don't have a problem, and I don't need to fix it. But typically, if you're having challenges with sleep onset, the recommendation is not to exercise too late in the evening. There was a study done in adolescents, young adolescents that are athletes, and if you finish your exercise routine after 8:30 p.m. versus before 8:30 p.m., it makes a difference. It makes a difference regarding how well you sleep. And so part of that has to do with body temperature. It might have to do with neurochemistry when you're active. But if you have a choice, ideally trying to finish your activity somewhere 4 to 6 hours prior to bedtime.
Well,
If sleep is a problem,
if
falling
it's a
asleep is a
problem.
problem.
Yeah.
That's
Okay.
right.
So 4 to 6 hours. But, I notice, for example, 4 hours is probably okay. I tend to be a morning
Yeah.
gym person. For me, my hack to play, honestly, is going to the gym. And it
Mm-hmm.
looks different for everyone, right? And for kids, it's definitely not going to the gym. But I
Right.
agree, I notice if I work out too close to bedtime, I can't fall asleep, and maybe to your point,
Yes.
it's my body temperature is too hot. My heart's still going a bit. I also notice though that if my kids are, reenacting a circus, 10 or
Mm-hmm.
15 minutes before bedtime, I
Yes.
have the same issue, they just can't quite settle down. And so I agree that as a parent, one should notice, when do I need to sort of shut down that activity, right? And do some quiet reading
Yes.
time or whatever that sort of routine is that you have. Talk to us a little bit
Mm-hmm.
about those sort of routines and what you
Yeah, sure.
recommend.
And it's funny that you mentioned that, if children are getting riled up in the evening, it's fascinating in that, we think that children's overall maturity level, their ability to have impulse control, as you get more sleepy, those things diminish. And
Hmm.
so if you're hitting that wall where you're like, wow, my child is just so active that it's hard to calm them down, the typical line is, well, let's try to actually move their bedtime earlier to try to avoid getting them overly tired, because that might paradoxically show up as increased activity versus sleepiness and tiredness. So, when it comes to the routines at nighttime, typically having a 20, 30-minute routine that you do the same way every single night with 3 or 4 calm, relaxing activities, whether it's brushing teeth, taking a shower, putting on pajamas, getting clothes ready for the next day, maybe some light reading, prayers, etc., whatever the family chooses to work into that time. And your brain is a creature of habit. It learns that when I'm going through these steps, this should be my calm down time, because I'm going to fall asleep after this, or I'm going to be expected to be in bed after this. And so it starts to link, okay, I'm going to start relaxing my brain because I know what's coming. And that those associations are a very powerful tool. The same way that when you go into the gym in the morning, your brain is getting revved up because your brain already knows what's going to happen when you're in the gym. If you walk into your favorite restaurant, you start feeling hungry because you know what's going to happen there. So those associations are really, really important. We also recommend keeping things cool, quiet. Somewhere between 68 and 72 degrees is a typical range. Cooler is typically better when it comes to depth of sleep and sleep onset. We like to avoid bright lights 20, 30 minutes prior to bed. You don't want to have a cell phone really close up to your face, or lots of screens in your room. And then you want to avoid things that could be disruptive of sleep, particularly for adolescents when it comes to caffeine use.
Yeah.
We know that can be disruptive. And nicotine, when it comes to vaping, that can also be disruptive to sleep.
Yeah, I want to pull out some gold that I just heard in what you said. So, a couple of things. One, parents should think through, with teenagers who have sort of later sports practice, that could be affecting sleep, right? And note that. And how are they sleeping? What are they like the next day? How active are they the next day? Also, this really hit me, that you said, if you're noticing that the active play is sort of like escalating right before bedtime, that may be that your kid's actually overly tired, and sort of
Yes.
their ability to control those impulses, etc., is really falling apart. And I think even as a pediatrician parent, sometimes I misinterpret that. I think, oh, like, gosh, they have got so much more energy, I need to wear them out further,
Yes.
instead of thinking about, oh, actually, this is a sign that bedtime is happening too late, and that we
Yes.
need to move things up and start to slowly move that routine that you just
Mm-hmm.
talked about, so that we're triggering all the bedtime cues, right, up
That's
further.
right. That's right.
And that's gold.
And
I love it.
and
I love it.
and I forget, somebody mentioned this to me, and this isn't based on any science, but they say, children, when it comes to late evening hours, if they're getting past their bedtime, they tend to regress developmentally by about 2 or 3 years when
2
it
or
comes
3
to
years.
maturity
I do
level.
too. Yeah.
I do too, exactly.
Yeah.
Yeah. I'm like maybe 20, 30 years.
Yeah. Right. I
But,
wish.
and it's interesting how sleepiness manifests differently depending on the age. So we know that toddlers manifest sleepiness and tiredness with irritability and sometimes hyperactivity, whereas your adolescents mimic more the adult pattern, which is things kind of slow down, they get sleepy and tired. And so that's not only with sleep disruption or decreased amounts of sleep, but also with sleep fragmentation, poor quality sleep. So if you have, for example, obstructive sleep apnea, that oftentimes presents with an ADHD-like picture for our young school-age children. So just something else to keep in mind.
Yeah, yes. And I think that if you're noticing, just as a pediatrician plug here, and to emphasize the importance of pediatric sleep experts like Dr. Kansagra, if you're noticing that your child really has a lot of trouble sleeping, and you're noticing that behaviors are falling apart, especially on lots of nights that you note that they're not sleeping well, they're tossing and turning, they're moving around a ton, and there are a lot of other red flags that pediatricians know what to look for. Definitely, as a start, talk to your pediatrician about those things, and they know sort of what kind of conversation to have with you, and then they'll also know when to refer you to a pediatric sleep specialist. So just a plug for, there's a ton of expertise behind what Dr. Kansagra is saying, and so if you're sort of wondering, wow, like, my child really struggles with these things, that might be a conversation to have with your pediatrician for sure.
At Active Play Every Day, we talk a lot about why movement matters for kids' bodies, brains, and emotional health. That's why we're so grateful to have Next Playground as a partner of the show. Next Playground is an active play gaming system designed to get kids moving indoors, using their whole bodies to dance, jump, fly, and laugh. It turns everyday space into a place for meaningful and joyful play, the kind of play that supports development and helps kids get the activity they need. Learn more about Next Playground at nextplayground.com.
Okay, so Sujay, we talked about some of this routine and triggering sleep, and the Lullabee that you invented actually probably works some of that in and gets kids into these familiar patterns that helps lull them back to sleep and helps them get to sleep. And so I know that you're an expert in this area. And, the brain is triggered that way, right? And with active play, the brain is triggered in the same ways, but there are sleep effects, and those are kind of taking the science a few steps further. So, Ray, talk to us about kind of the way active play and exercise triggers sort of circadian rhythm, how daylight works into that when you're out, playing in your front yard, and how all that integrates with sleep.
Yeah, that's a great question, and I feel like we could talk for like hours about the circadian rhythm. But the 10,000-foot view is that we all have this roughly 24-hour loop that's playing in the background in our brains. That's giving us an alerting signal, amongst many, many things that it does. It gives us an alerting signal, and it repeats in that loop. And there are only a few things that actually will shift your circadian rhythm timing. And we know light exposure is the main thing that sets our timing of our body clock. We know that melatonin exposure, if we give it exogenously, that can set it. We know that timing of food intake, social interaction, and exercise. And that's really about it, And so we think timing of physical activity, particularly in the earlier hours, can help solidify timing of your circadian rhythm. And then if you combine that with the light exposure to light that you receive in the morning hours, that also helps set your circadian rhythm every morning. That morning light exposure is one of the most important parts of keeping that loop in a 24-hour pattern. Because naturally, our circadian timing is actually a little bit longer than 24 hours. If you lived in a cave and had no idea what the temperature, what the light exposure was outside, what time of day it was, you would sleep in a roughly 24.1 or 0.2 hour pattern. Morning light exposure tells your brain, nope, we got to move it a little bit shorter. It's actually 24 hours. So super important.
I believe there's a study, and I'm going to try to find it and put it in the show notes to show that if kids, for example, with ADHD, and I think this then applies to any kid, get up and can do some exercise before school in the morning. They get that light exposure. They move their bodies, that their ability to engage in school and sort of the behavior issues that they may not have then at school are really improved. And we're going to meet with some other experts. For example, there's a bike bus where kids join along with a group of parents and bike on the way to school. And so thinking about how all this integrates with wellness for children and families, both what you think of as the, active play throughout the day, but really then that integration into your circadian rhythm, all the way into the quality of your sleep at night. I think a lot of folks wouldn't realize that, just thinking, I'm getting my activity in early, but there's all these other effects that are cumulative and then will set you up for another good day the next day, which is so cool.
Yes, 100%. And I think one of the Scandinavian countries, I remember they have many recesses throughout the day of school, and the academic performance is actually much better, right? And we're like, oh no, it's just not natural for our young child to have to sit in one spot for a long period of time and try to have prolonged attention. They need those outlets. They need those healthy, active outlets to re-engage their minds, not just for sleep at night, but even during the daytime. So it's a fascinating area of study. And so for younger kids, more active recess time, not less in school.
Yeah, 100%. I think we're going to have an entire podcast dedicated to recess time.
That's great.
And we were also talking to some school experts that have integrated physical activity more into even the classroom. So I couldn't agree with you more. And, just thinking through all these integrations with sleep and wellness and how then sleep sets up your next day is really pretty profound. And it's why we're doing this podcast. One of the things that often comes up in the media and things that parents are reading online and ask their pediatricians about are screens. It's in our, everyday lives. I believe Toy Story 5 or something is coming out this summer, and the villain is going to be a tablet,
I
to
love
take
that.
away the attention of all the toys, right? And so,
Yes.
screens and sleep. What should parents be aware of for themselves? Because parent quality of sleep super important, right? And
Hmm.
also for their children. How should we think about how these two things affect each other, especially the sedentary screen time when you're, just sitting and staring with that glowing light?
Yes, yes. This is one of my favorite things to try to combat in adults, where I'm like I'm post these reels of telling adults just to go to sleep, instead of scrolling on their screens. It's challenging because there are multiple ways in which screen use could disrupt sleep. One is just by sheer volume of time. We only have so many hours in the day, and if you're engaging in screen use and it's cutting into your past your natural bedtime, of course you're going to be limited. The second thing is the neurochemistry that's elicited from screen use. So oftentimes it's social media related activities, things that may be triggering emotions in us. We may be getting feedback from others regarding the posts that we put out there. So the neurochemistry of dopamine and norepinephrine are just not conducive to sleep. And the third factor is the light exposure. We know that artificial light, our brains can't tell the difference between that and sunlight. So it's thinking, oh, it's still daytime outside if the light is bright enough and you're exposed to it long enough. So that can hurt your natural melatonin secretion. Now, we think about that in children, and there's good data. The more screens you have in your room, the more sleep challenges that you have. If a child has a TV in their room, they tend to have more sleep challenges. The data in adults is getting a little bit grayer when it comes to, for example, TV use in the bedroom, because we know that for a long time it's been helpful for some that suffer from insomnia, etc. So that part we'll kind of put to the side. But for children, I think we can all agree that screen use in the evening hours will be a net negative when it comes to sleep.
Yeah, especially if it's replacing things they should be doing, right? Like being
Yes.
active, playing with their siblings, eating a good dinner, all of these things,
Correct. Totally.
collaborating and connecting with their parents. It's sort of what the screens are stealing away. And then to your
Yes.
point, this idea of the light and how is that really affecting us? It's
Mhm.
interesting. A parent I talked to said that her, bedtime routine, that sort of like quiet down routine, includes watching an episode of Bluey every night. And
Yeah. Yeah.
she doesn't identify that this, harms her kid in any way. And her kid's able to then
Mhm.
sort of settle down and have this quiet time and get
Mhm.
to sleep. And so I think if
Yeah.
that works for your kid, great. But if you're
Mhm.
noticing that sort of these bright or really engaging or energetic type screen, or, whatever it is, a show or a Nintendo Switch or whatever it might be, it is getting in the way of bedtime, you should try to back that up and see if that makes things better and replace it with, you know, reading on a low lit Kindle or a book or, something like that. And see if that improves
Yes.
things.
Yes, and it's actually fascinating because there was a recent study looking at the timing of smartphone use when you give your child, your adolescent, a smartphone, and the earlier they get it, the worse sleep gets, and it's fascinating that delaying it as much as possible, both for sleep, for physical health, for mental health. If you're a parent listening to this and you're on the cusp of like, should I go ahead and give my child that phone because all of their friends have it, you know just delay as long as humanly possible, because it really just worsens everything, and it will become the focus point of their life. Right? Before they have it, it's usually friends, it's usually schoolwork, it's usually family. After they get that device, it now becomes the focal point of their life for the rest of their life. And so, just
Yeah.
something to keep in mind.
Absolutely true.
Yeah.
And Sujay, I've been caught by you in the middle of the night, scrolling or at my bedtime, scrolling Instagram, and I get one of your
Hmm.
amazing reels that tells me to go to sleep. And I chuckle and often I
Do you
actually
listen?
put my phone down.
Good. I
Yeah.
get that a lot,
Yeah.
so that's why I keep making it. People are like, all right, I'll do it.
Yeah.
I'm like,
It's,
fantastic.
yeah. And you have just so much good information there. So, to everyone, if you've really enjoyed this episode, please check out that sleep doc. And so, Dr. Consagra, how would you write a prescription to your patients about how to get into that cycle to have active play and sleep really helping each other?
Yeah, I would say a prescription would have active play and light exposure, ideally early in the morning. It would have calm and relaxation for the 20-30 minutes leading up to bed without too much rigorous exercise. And it would have a balance of avoiding excessive screen time so you can have the opportunity and the desire to go out there and get that active play and then benefit your sleep in the evening.
I love it. All right. I never know how to thank people at the end of a podcast. I need to figure that out because I have a ton of gratitude for you.
Yeah, just be like,
Yeah.
yeah, I'd be like,
And if you want to
thanks,
know more,
see ya.
Yeah, exactly. All right. So we need to probably put like the blooper reel in, right? Yeah. So Sujay, thank you again. This was so fun and so important. And for those of you who want to learn more, we'll put, Sujay's full bio in the link, show notes down below, as well as links to his various social media platforms where you can learn more about the importance of sleep and how to optimize your sleep, both as a parent, as a person, and as a child. And then also to learn more about his brand new sleep product, the Lullabee, which is just super exciting. And in fact, my youngest kid just got transitioned out of his toddler mattress, crib mattress. And I wish you had just been a year or so sooner. I would have loved to have tried it because we could have used some help for sure. But we'll put a link in the show notes as well if you'd like to learn more about that. And if you've got a baby on the way or have one now and want to learn more.
Amazing. It's great to be here. Thanks for all you're doing to get kids moving and sleeping.
For more tips, resources, and show notes, visit activeplayeveryday.com. And if you found this episode helpful, please help us out by rating and reviewing the show from wherever you're listening. It really helps other families find us. Until next time, consider this your active play prescription because play isn't extra, it's essential.